Hi everyone, my name is Cade Heimberg, and today we're going to be looking at a case study on drug abuse. This is for a class called RP&SE 121 at UW-Madison. Meet Katie. Katie is a 35-year-old professional with a thriving career and a wife, Susan, and two young children. Katie's doctor prescribed her pain medications following a low back injury sustained in a car accident during her mid-20s. The medications helped her find relief from her pain at first. Over the next several years, Katie's life complexities grew with marriage, parenthood, her career, and the stresses of daily life. As her stress grew, Katie remembered how the medication she took for her back made her feel better in the past, and so she found herself making excuses to go to the doctor's office, often seeking additional prescriptions. Her interest intensified whenever someone she knew had experienced an injury, and she would often ask them about which medications they were prescribed by their doctors. Meet Katie's wife, Susan. Now, from the case study, it's clear that Susan was unaware of Katie's addiction for quite a long time, but the situation became evident to Katie's spouse, Susan, when a FedEx delivery arrived with a package requiring Katie's signature. Upon shaking the box, Susan heard a distinct rattling sound and discovered a large quantity of pills upon opening it. Reflecting on similar packages delivered in recent months, Susan became deeply concerned about Katie's possible addiction and is uncertain about the most effective way to offer support. So, what is actually happening here? Katie's case suggests the potential abuse of prescription pain medications, particularly opioids. The reading by Hines delves into the opioid epidemic and the nuanced ways individuals may transition from legitimate use to problematic misuse. The reading especially emphasizes the risk associated with initially prescribed opioids for pain management, and it outlines a trajectory that aligns with Katie's journey from a documented back injury to actively seeking alternative forms of pain relief afterwards. Katie's wife, Susan, has discovered her addiction, but is opening a door for a turning point in Katie's substance abuse problem. What has gone wrong in this situation? Katie's escalating substance abuse poses a significant threat to her daily functioning, her life, and her career and her family. This aligns with the broader issues discussed in the Hines reading, which emphasizes how the misuse of prescription drugs, especially opioids, can lead to severe consequences. What needs to be addressed in order to improve this situation? The secretive nature of Katie's behavior, as implied by Susan's discovery, suggests a lack of communication and trust between the two. The Muller reading addresses the importance of communication in addressing substance abuse within relationships. The lack of transparency observed in Katie's case reflects the challenges that couples face when navigating addiction. But what has gone right so far? Katie's initial use of medication, as prescribed for a legitimate injury, indicates a history of responsible use. This aligns with the discussion in the readings about the legitimate use of opioids in managing pain. Susan's concern and desire to support Katie demonstrates a potential support system for her recovery. The Ollie reading emphasizes the crucial role of family and social support in the recovery process. Susan's engagement can be a positive factor in Katie's journey and a possibility for her to overcome substance abuse. What are the factors that are likely related to the situation? From her case study, we can clearly see that work-related stress, accessibility of prescription drugs are clearly all contributing factors to Katie's substance abuse. Now, we're not sure where exactly she's getting the drugs, but from the case study, we learned that they're being delivered to her by FedEx, and one can assume that she's ordering them online or having friends send them in. We're not completely sure, but her accessibility to the prescription drugs needs to be addressed. And we also aren't sure if Katie is still struggling with chronic pain as a result of her injury, but one could argue that that could be a factor as well, and it should be looked into. So, how do these factors have influence on the situation? Well, the Fox reading discusses the relationship between chronic pain and opioid use, emphasizing how individuals may turn to substances to cope with this stress and pain, which clearly Katie has a lot of in her life. I'm sorry, my computer glitches on that slide. Evidence. So, what has been shown to work in these kinds of situations? Evidence-based therapies, particularly cognitive behavioral therapy, as discussed in the Fox reading, can address the psychological aspects of chronic pain and substance abuse. CBT can help Katie develop coping mechanisms for stress and pain that do not rely on opioids. This can also help her deal with triggers that she might have. Inpatient rehabilitation, as discussed in the Oliver reading, is also a viable option for Katie to provide a structured environment for detox and intensive therapy. This can address both the physical dependence on opioids and the underlying psychological factors contributing to substance abuse. Support groups are also another great option for chronic pain sufferers and stress related issues, as suggested in the Power and Burgers reading. They can offer Katie a platform to share experiences and learn coping strategies from others facing similar challenges. This communal approach aligns with the reading's emphasis on the importance of peer support. So, what else do we need to do to make a viable plan? Before finalizing a plan, it is crucial to assess the extent of Katie's social support network. The Ali reading emphasizes the pivotal role of family and social support in the recovery process. Understanding the dynamics of Katie's relationship with Susan and identifying other key individuals who can contribute positively to her recovery journey is essential. Additionally, a more in-depth exploration of Katie's medical history and the specifics of her chronic pain condition is needed. The Birking reading emphasizes the importance of tailoring interventions to the individual's unique pain experience. Gathering detailed information about the nature and triggers of Katie's stress and pain can inform a more targeted and effective treatment plan. Where can we go to get this information? Well, to start, we can suggest that to assess Katie's social support, conducting family sessions with a qualified therapist is recommended. This aligns with the Ali reading, which underscores the value of involving family in the recovery process. A skilled therapist can facilitate open communication between the family and identify potential sources of support within Katie's social circle. It can help her find local treatment options such as rehabilitation centers for her substance abuse or doctors and other outlets such as physical therapy or yoga that could help her manage her stress and pain. So, an initial plan of action, we can try this over the next week and month. In the short term, initiating open communication with Susan is critical at the start. Expressing concern and encouraging Katie to attend therapy can be the first step. This can be done with both Susan and Katie, or suggested to Katie to do one-on-one with Susan. This aligns with the Muller reading, which underscores the significance of communication and involvement of loved ones in the recovery process. In the medium term, exploring inpatient rehabilitation options for detox and intensive therapy is recommended. The reading suggests that it is key for inpatient programs to address both the physical and psychological aspects of substance abuse. But what should be tried in 6 months? In the long term, engaging Katie in support groups and involving the family in therapy can contribute to sustained recovery. This approach aligns with the Ali reading, emphasizing the role of social support networks in the recovery journey. Developing coping mechanisms for long-term stress and pain management is crucial. And here are my references. I hope you guys enjoyed this presentation. I look forward to your feedback. Thank you for a great semester and happy holidays.